Vaccines are one of the easiest and safest ways to protect you and your family against vaccine-preventable diseases, like measles, polio, COVID-19, and more. Different vaccines are needed based on your age, health, and international travel plans, so it's important to talk to your provider about your specific situation. You may have questions about vaccines that are recommended for you and your children, like why are shots recommended at specific ages? What to do if we are behind on vaccines? Can we spread the shots out for children? And which vaccines do we really need? We encourage you to ask these questions when you see your provider. In this video, we cover why vaccines are important to receive at specific ages. Then providers can have a more in-depth conversation about routine vaccines, any questions you have, and the precautions you and your family should take. Your age and sex typically determine which vaccines are recommended, so we base our guidance off of these categories: birth to 6 years, children ages 7 to 18, adults 19 and older, adults 50 and older, and women who are pregnant. Let's take a look at the CDC's recommended immunizations for children from birth to 6 years old. They are broken down by the child's age in months for 2 reasons. 1, we have determined when the vaccine will work the best for your child's immune system. And 2, this is when your child needs the protection the most. Let's use measles as an example. Babies get antibodies from their mother during pregnancy, as long as their mother has been vaccinated against measles. But this gift from mom starts to wear off around 12 months of age, so the perfect time to vaccinate your child against measles is soon after they turn 1. Why? Because before the age of 1, the mother's antibodies will block the vaccine from working as well as it could. If you wait too long, your child is vulnerable to measles, which is very dangerous for young children. This is just one example that will help you understand why vaccines are recommended at specific times, and the vaccines received during childhood can provide lifelong immunity against vaccine-preventable diseases. Not all vaccines provide lifelong protection, though, and many adults may not know that they need a tetanus and diphtheria booster every 10 years. There are also vaccines that are only recommended for adults over the age of 50, and others that should be administered if they were not received as a teen. These are things you can discuss with your doctor. COVID-19 vaccines are also safe to administer with any other vaccine, so you can receive your primary dose or booster anytime you visit our clinic for another vaccine. We recognize that the list of recommendations can be confusing, so we're here to help answer any questions you have with your doctor. Your visit today will also give us a chance to talk about vaccinating against COVID-19. Vaccination is recommended even for those who have had COVID, because the combination of the previous infection and vaccination seems to offer the greatest protection. And if you do get sick, vaccination gives you a far better chance of recovery without any serious incidents. Your provider can help you decide which vaccine to get, so be sure to discuss this with them today.